Thank you for listening to the P-Pod from the Somerset Safeguarding Children Partnership. Due to the nature of this podcast, themes relating to the abuse and neglect of children are discussed. Therefore, listener discretion is advised and the content unsuitable for children.
Welcome to the P-Pod.
Right then, welcome back to the P-Pod, the partnership podcast from the Somerset Safeguarding Children Partnership. My name is Steve Maccabee. I'm the multi-agency training manager for the partnership itself. And I'm really pleased to be joined today by a number of guests in the studio, where we're going to be talking about a really important topic, but one that has a lot of crossover with a lot of different other topics that we've been talking about over the last few episodes. And we're going to be talking about sexual health and the work that SWISH, the sexual health service in Somerset, provides. And importantly, how they work to support children and young people, but also navigating some of those difficult areas like concerns, vulnerabilities, risks, and exploitation for children and young people. So thank you very much, guys, for joining me in the studio today. Can I ask you to introduce yourselves?
Hi, so I'm Cassie. I work as part of the targeted outreach team within SWISH as a trainee assistant practitioner.
Hi, I'm Marina, and I'm the young person sexual health nurse for SWISH.
Hi, I'm Kerry. I'm the lead nurse for the targeted outreach team, as well as currently lead nurse for SWISH.
Thank you, Kerry. So as I say, we're going to be talking about SWISH today. Some people may well be very familiar with you. Other people may never have heard of SWISH before. So could one of you sort of explain to me sort of what is SWISH and what is the work that you as a team undertake? And I guess how does that sort of fit in with the wider health system within Somerset?
SWISH was established in 2016 when the contraceptive service and the GU service in Somerset integrated together to offer contraception and sexual health county-wide. SWISH stands for Somerset-wide Integrated Sexual Health Service. So we see anyone for contraception and sexual health from 13 and above. So offering advice, treatments, testing, ongoing long-acting contraception, short-acting emergency contraception, as well as other treatments, be it vaccinations, pre-exposure prophylaxis for HIV, post-exposure prophylaxis for HIV. So lots of things around sexual health.
So not just condoms and pregnancy testing. It's important because actually often we do have quite a narrow view of things, don't we? It's a sexual health clinic. It's it's providing lots of condoms for young people, and that's about it. But that's certainly not the case in terms of what you do, is it? But I'm just interested to pick up, Kerry. So you said in terms of the age range, it's from age 13. I'm just thinking within that, obviously the age of statutory rape is below 13. Is that the reason for that age range there?
Yeah, mainly. And obviously it's advice and information and kind of discussions. It's preparing people, educating people as well. So it's accessing our service to be comfortable with that service. But obviously some people are having sex under 16. We know through recent research our county council colleagues have done that most people wait till they're about 17 to have first sex, but it's supporting those that are younger. But obviously in line with the law.
And I'm just thinking, in terms of young people who come through your door, are there any kind of particular themes that you see in terms of their needs, or are you seeing a kind of change over time? I'm just curious. Marina, I'm just thinking in terms of your role with young people. Do you see sort of common themes coming through?
Well, I think really for young people, it's probably the pressure that they feel they're under with regards to peer pressure or social media, and with regards to relationships and them trying to navigate what they want from a relationship and what they feel under pressure relationships should look like.
Did you see more girls than boys coming through the service, or is it a bit of an equal mix?
I see more girls, but of course we do see boys as well, but majority of the girls.
Are you seeing those same sort of themes in terms of those pressures that you talked about for both genders, or is it mainly for girls?
No, I'd say it's for both genders, definitely. The boys sort of, are under pressure as well from how they think they should act as, a male or towards a female, if it's male and female relationships. So the pressures, I would say, is pretty immense for males and females.
Do you feel in terms of that pressure, is it to have sex earlier or to do certain sexual acts or anything? Is there anything you sort of see coming through?
I think it's sort of expectations of each other and what and themselves, how they think they should be acting in a relationship, communicating with each other, as well as the actual sexual acts. There's sort of obviously things that they're influenced by social media or porn, that's more accessible for young people, obviously with the internet. So that can skewer what a healthy relationship is, I feel.
I think a lot of it is pressures from kind of peers and like social media. We get a lot coming in looking at contraception because they've seen the like scary things about depot injections and things on like
Yeah, they get information from TikTok as well, that the depot's no good. It will make you go blind. I've had a young person worried about, or it could cause a brain tumor, which obviously it doesn't. We wouldn't give it if it did. So information can be obviously the wrong information.
That rise in sort of not just online harm, but online use and communication and what have you is huge, isn't it? And it's growing all the time. And I was just wondering, actually, on the back of that, have you seen a change at all? I guess sort of going back to the COVID lockdown periods, because there's been sort of quite a lot of conversation about the effects that has had on children, young people in particular. And just picking up from what you're saying, Marina, around sort of social skills and communication and understanding relationships. Have you seen a change in the kind of post-COVID world that we're in now with more online use at all?
I guess it was you. Obviously, the young people were still getting the information pre-COVID, but I think now it's really sort of the main source of information that young people go to is the internet and influencers and TikTok. And so I guess that's definitely increased, I would say, since COVID.
I do feel sorry for young people these days, to be honest, because I think a lot of it is a real challenge between navigating what's factual, what's real, what's influencing and saying whatever kind of works as opposed and sort of what is what's false news that hits the headlines, get that good sort of soundbite there and sort of hooks people in, but actually isn't true. I think it's a really difficult situation for young people trying to navigate all of that in amongst the real world as well.
I think it's difficult for adults as well, as even not in sexual health, just generally, it's very difficult. So to be a young person and trying to be safe and get the right information in order to make informed choices, it's even harder now than what it ever was.
No, I think so. I'm with that. I've worked with young people for many years, and I know there are some huge reluctances sometimes for young people to become engaged with sexual health services. Do you kind of see that? Well, I guess what are some of the biggest challenges that you see for young people accessing SWISH, and how do you kind of work to overcome those? Is there anything particular that you do? Any outreach programs or anything?
Yep. So it's really difficult, obviously, because we're covering Somerset, so that's a really, really fast area. And obviously young people aren't driving, so they're having to rely on an adult if they live in a village or to access our services. But we do have on the website, we do have the Just Ask part on the Swish website, which they can email in or ask a question on. And that's quite popular from all ages, actually. And then we try and work with other professionals as well to help them to access our service if that's what they want, obviously with their consent. And we're aware of obviously the times. If they're in education, then we have to make allowances for contacting them after school hours because they can't have their phones in school or anything. And texting, they may prefer text or they may prefer emails, because actually having a conversation over the phone can be really difficult for young people because it's not happening on a normal, they prefer to text or email. So we're very aware of that.
Keeping up with the times.
Trying.
But also, I guess with that, it can be embarrassing, can't it? And I'm thinking, particularly, I don't know, if you've got an STI or something like that, and you've never had anything like that before, and all of a sudden you're talking to not only a stranger but an adult as well, about these things, you can understand how it's a lot less threatening to search on TikTok and have a look on things and take that as kind of the fact. And if somebody's saying, don't worry, it'll go away or whatever, or it's fine. But then to actually verbalize that to an adult and go, oh, I need to tell you this is a bit awkward here. So I guess, like you say, utilizing those say technologies, but those other methods of communication, I guess, like say, like sort of text messaging or what have you. But I think, can really work to break down some of those barriers and that embarrassment, I guess, as part of it. I'm just curious about you mentioned about the website and the Just Ask. And is that like an FAQ, or have you got somebody sort of live responding to that, or AI responses or anything?
It's one of the nurses that responds to the questions. So somebody will post a question, then we either then publish the question and answer on the website, or we reply privately. And we also have Facebook and Instagram that people can direct message through. So they will have an automated response, but then one of the team will reply to them with the answer and have a chat that way. So there's other different ways of contacting us and kind of trying to break down those barriers to then accessing the service. So most of our services, apart from Millstream at the moment, are based in community hospitals or community kind of sites. So you are quite anonymous when you're going there, because other people in the waiting room don't know why you're going there. And we don't kind of come out and go, who's for SWISH? It's normally just a first name call. So you could be attending for anything.
And obviously, we've got those sort of general barriers, I guess, for young people and adults as well, to be fair, I think. Do you see anything in particular in terms of any, I don't know, cultural barriers or societal stigmas that prevent young people from accessing your services and support? And, is there anything that you target particularly to target particular groups, or any particular barriers that you see?
So I go out on, I do a lot of outreach, and we look at like freshers fairs. So we go into the colleges and we do a lot of health promotion. And we advertise C-Card, which is Somerset free condom scheme for young people up to 19. We go into kind of the YMCAs where they're less likely to want to come and see us. So we go and visit them and do kind of testing and contraception and things in their safe space. We go into some of the children at after homes. Yes, we try to kind of make it as easy as possible for anybody that may struggle or have anxiety about coming into the clinic. Then part of our little team will, and we are able to go out and see them where they feel safe and that they feel most comfortable.
I think I was quite keen to pick up on themes as well, as we've been talking about just now. And obviously a theme that's been coming up nationally for quite a number of years now, and certainly going back, I'm not pretending this is suddenly when it started happening, but certainly when it sort of really came apparent, I guess coming out from the Everyone's Invited website, and then the subsequent Ofsted National Thematic Review into child-on-child abuse. And Marina, you mentioned sort of about understanding relationships and healthy relationships. I guess how do you kind of approach those conversations where you've got those concerns for young people around sort of child-on-child abuse or not understanding relationships or those challenges within young people's relationships now?
I think we ask everyone, their sexual history, who they've had sex with, and then it's about being curious and sort of asking, how they met that person and sort of the friendship groups that they're in. It is mostly really about having curiosity around the relationship and discussing, what they're happy with, what they're not so happy with, and having open sort of conversation with them. So it's having a chat with them really, and not making it so sort of like tick box, and sort of exploring how they've been in the relationship, how they met them, if their parents have met them, and just sort of exploring how they feel. Are they comfortable with them? Do they feel under pressure? And exploring their relationship with them. Can they talk to them about sex? I mean, if they can't talk to them about sex, but they're having sex, then that's concerning, and how their relationship is, being a bit nosy, really.
And are you seeing that as a thing coming on of challenges in relationships and pressures and things? And are you seeing that coming through as a fairly regular issue around concerns around child-on-child abuse?
Well, yes, because I guess it comes from that pressure, and it comes from their expectations of themselves and others in a relationship. So then it becomes an abusive sexual relationship without them even knowing it is, because obviously they're in it and their expectations are not good of themselves and that other person. So it's sort of trying to unpick it really, and trying to sort of explore that relationship and what they truly feel comfortable with and not with.
And are you seeing young people coming through where there are concerns around domestic abuse within that teenage relationship? Or is it coming through more around sort of sexual pressures or anything like that?
I think it's relationships generally, whether it's becomes physical or not. There's kind of that theme that's they're trying to navigate what a positive relationship is and how they want to be in that relationship. It's, probably their first relationship, so they're kind of working it out really, aren't they? And obviously all the pressures, the external pressures, or even, their home life pressures all plays a part in that.
I guess picking up from that theme as well, as you were saying, young people, with it being sometimes often the first relationship they might have had, not necessarily kind of recognizing potential abuse or potential exploitation for them. We know in terms of child sexual exploitation, often we might talk about things like the boyfriend model, where victims don't recognize that they're in an abusive relationship. In terms of information sharing for you guys, and obviously within the health sector, there is quite stringent guidance around the sharing of medical information for individuals. How do you kind of work to balance sort of the safeguarding information sharing guidance with the medical information of individuals, particularly when you've got concerns where there may be exploitation taking place? And I feel, from my perspective, that could be quite a tricky thing to navigate sometimes. But how do you kind of work in that arena where you've got concerns about a young person? You think, actually, like you say, Marina, you're having those conversations, trying to explore that a little bit, and you're thinking, this isn't sort of quite sitting right. I haven't got any definitive, but
Yeah.
this isn't sitting right. How do you kind of navigate that?
And we have a really good team within SWISH, that we can talk to and air our concerns. Also, we have the safeguarding advisory service, which are great. They're always there to pick up the phone or to send an email to. So that obviously really helps sort of in-house. And then depending on, what we're advised, then obviously we follow that up. And it is very tricky. Sometimes it can feel more straightforward if there's a social worker already, or if there's carers already working with that young person. Then we work together and still encourage that young person to access SWISH, for their sexual health. But it's really about trying to work together. If they haven't got a social worker in place or a carer, then obviously our safeguarding advisory service is really important to us to guide us for the next steps, really. But it's all about communication and talking with the team.
But I
And
think it's all like you said, Marina, you have those conversations with young people, and sometimes they're not even aware that their first sexual relationship, and you're sort of talking about how is it for them, and you're kind of picking it apart with them, that sometimes it's them sitting back and realizing that actually it's not healthy, and then you're supporting them navigating it that way. And so they're fully involved a lot of the time in that process of sharing information. Obviously, we let them know that we're concerned about them and what's happening to them, and why we then have to share that information. Because sometimes, until we have those really open conversations, and all of our young people, when they come into the service, are given a lot more time to be able to be with that clinician. So we are able to have an hour appointment with young people and kind of have those discussions that they might not have shared with mum or dad or peers, and kind of sitting down and talking about, are you happy with that? Does that feel right to you? And kind of, can you say no if you wanted to? And all of those things that, unfortunately, a lot of the time young people will say, oh, I just let them get on with it because it was easier than kind of stopping them. And it's kind of then giving them the strength and the ability next time, and obviously talking through that wasn't right and what they can do to empower them for next time. So I think we are, as a service, really good at holding people and kind of supporting them and kind of giving them those skills, as well as then kind of working with other agencies to continue that work. So we are bound by confidentiality, but everyone we see, we explain, if we're worried about you or someone that you talk about, then we do have to share this on. So it's not kind of completely closed off, we never share. We just are able to have those conversations like we talked about sex. Not everyone's comfortable to talk about. So they come in and they really do have an open conversation with us that we can then pick it apart and kind of move forward.
And on that, and we talked about exploitation there, but I think one question that I see coming in to me quite frequently is if you have a young person who you feel maybe vulnerable, but they say, I don't want my parents to know this. How is that sort of, do you just sort of honour that regardless? Or do you say, what are the sort of balances that you need to kind of weigh up with those things? And where does that line sit?
So you do the phrasal or Gillick competency with them. So obviously that assessment will then, we know whether they're actually able to understand that information and obviously judge whether we do have to tell their parent because they don't understand. But then we talk to them about why they don't want to share and obviously the benefits of sharing, but also it might be risky. Obviously, some young people live with parents, domestic abuse situations, stuff like that, and actually it's safer for them not to share, but have somebody else outside the family that they can share with, or have that support from that clinician to have that kind of regular input from. So as much as possible, we support people with, it's better to let your mum know we're starting you on this pill or whatever, but sometimes it's just not safe to do so. And so we treat everyone.
There's a lot of factors to weigh up there, and like particularly if you have got concerns about exploitation, and you've got somebody saying, "But I don't want my parents to know. I don't want anybody else to know." Like, it's about navigating all those bits. And numerous factors, I guess, isn't it, to weigh up? And like we say about competency, talk about Gillick competency there and Fraser competency, but as part of that is that informed consent, isn't it, to actually understand, what it is they're consenting to. Whereas, like we say, in terms of exploitation, sometimes there isn't that understanding that they are actually being exploited. It must be tricky sometimes, I think.
Obviously, if we do have concerns about exploitation and they're worried about parents knowing, if that's their main concern, then obviously we still report that. We still speak to the young person, explain, we can't guarantee mum or dad not finding out, but I'm really, really worried about you. I need to let somebody know. And that's where we go through our safeguarding process. So obviously we don't just hold it, we share that information.
I'm just casting back, actually. We've recently recorded an episode with Dr. Anna Riddell where we talked about the support and services offered to children and young people who have experienced sexual abuse. I'm just thinking, how does SWISH kind of link in with this work? And I guess that's sort of alongside that, the multi-agency safeguarding partners where abuse or neglect is known or suspected. How do you link in with those wider services where a child or young person is known to have been abused?
So there's options out there that we can refer into and support the young person in accessing them. So say if a young person has come into us because they've been sexually assaulted, then we work closely with the Bridge, and then there's other options for counselling as well that they can access. I mean, sadly, there is a long waiting list for counselling services. But again, it's not just a matter of saying, here's the number, call it. If they're really struggling, we have that time with them that we can call the Bridge or a counselling service with them in consultation with them. So we can do that first step with them.
And obviously we talked about age ranges there starting from 13. I'm just thinking in terms of if a child under 13 had been sexually assaulted, sexually abused, would that then sort of fit more under the remit of the Bridge rather than yourselves?
So if it's sexual assault, then they go to the Bridge for forensics and everything, but then they would be referred into the paediatric service for ongoing, like follow-up care and advice and support.
We've talked a lot about the services that you offer. And, we're always in a constantly evolving world in terms of services and ways of working. We've already sort of talked about those a little bit here. I'm just thinking in terms of development of the SWISH service, how do you kind of work to ensure that the voices of children and young people really sort of feeding in to everything that you do, or the developmental ideas?
We contract to BU, which is our local LGBTQ plus service in Somerset for young people. So we work closely with them. They help develop and guide us on services for young people that their service as well as or in our local community, and as well as Marina can talk about the PPI work that she's done.
Yep. So the patient and public involvement is been amazing. So an amazing group of young people at Taunton College campus. They've been involved in helping us with a poster for SWISH, specifically from a young person's point of view. So they've managed to complete that, and that's going out across the colleges. Hopefully, will be up in display and within their IT systems. Hopefully, come September, and then hopefully with that, the aim is to grow it more within Swish. Maybe look at the website and maybe have the young people come into clinic and give us feedback. So we're hoping to sort of expand on that a bit more.
Young people are often very, very clear about some of their views sometimes. It'd be really good to get them in and get them looking at, actually, no, you don't want to have that there. And I guess the other question that I wanted to ask you as well, and again, it's a question that comes up for me quite a lot in training sometimes, is in terms of children with additional needs, with SEND needs, with learning difficulties, those vulnerabilities, how do you kind of work to engage with young people with those additional needs and make sure they get the right advice and support? Because I think as a society, we don't like to think of young people with additional needs as being sort of sexual beings. But how do you kind of work to engage with those young people to make sure they get the right support and the right help there?
I suppose, well, young people are young people, so we just obviously see everyone as individuals, but we also work, in the past, we've done work with Foxes, used to have, one of our nurses was the LD link with the team in Somerset. We have extra time. We have looked at whether we have particular days and times, quiet clinic, which we're still looking at whether we can facilitate. I think it's just an awareness when we meet people of what their additional needs are. And then normally the same clinician is working in the clinics that they work in each week. So it's building that relationship up. And so they see the same person. And then it's kind of individual care to them and their needs. And we have on our website easy read material and links. We've worked with other agencies in Somerset around offering support and advice, as well as like MenCap and stuff like that.
Yeah, we go out and do workshops with small groups of people with kind of learning difficulties, looking at consent, seeing kind of what they know, just creating a safe space for them. And yeah, just going through kind of consent and body parts and what they think it is kind of with touching, and just making sure that there's kind of like an understanding, but working with them to kind of teach them about kind of safety.
Just picking up on that around the topic of consent. Obviously, that's an issue that comes up a lot for young people. And Marina, as you mentioned right at the start, obviously, those sort of pressures and around sort of online pressures for young people and societal pressures they had. And I think consent is something that comes up a lot. How do you sort of have those conversations? Is there anything you do particularly that's really effective? You think, actually, yeah, this is a really good way of getting that message across?
I think actually the opportunity of the consultation is really good. You know, when we talk about what's going to happen in the consultation, because obviously a lot of people that come in are nervous, especially if it's their first time. So to explain that, you know, you're in control, you can leave at any time. And if you have symptoms, then obviously we'll give you the option to be examined. But if you don't want to be examined, you don't have to be. So already sort of laying that down right at the beginning and explaining that, you know, it's their choice. If they don't want to have a blood test, they don't have to have a blood test. But obviously advising if they, you know, if it's best for them too, is still their choice. So I think the actual sexual health consultation is a really good basis for actually bringing consent even into the here and now. And then it's a good way then of expanding on that and talking about relationships and sexual relationships. Consent doesn't have to be just sexual. It's everything. It's in every day, everything that you do throughout the day. There should be empowerment to that individual.
You're modelling that sort of work in the work that you do, those sort of general interactions, you're modelling that consent-based practice there.
Yeah.
And Cassie, you're saying you do the outreach work to young people as well. Are those sort of conversations that you have?
Yeah, absolutely. I follow the same kind of consultation as we would in clinic anyway. But yeah, we definitely kind of look at whether they felt safe, whether they were happy, whether it was something that they wanted. In like workshops, we look at like the traffic light game, so they understand and they can kind of put their opinions forward on what they think consent is, and then we kind of like move them around on where consent might lay in each kind of traffic light, and what is healthy and what isn't healthy. So yeah, we do work a lot with everyone, not just the young people, on any type of consent.
And I know schools have obviously been doing a lot of work over the numerous years now with the revised curriculum and consent coming into that. And do you find that young people these days are generally quite savvy around the topic, or do you still feel that there's a lot of uncertainty around the topic around sexual consent?
To an extent, they do know. I do think there's still a lot of uncertainty. Again, I think brings in social media when they're looking at kind of things like OnlyFans and stuff, and they're looking at porn. I think it can blindside them into thinking that some things that are okay and that is normal, and that they like other people doing it, so that's normal, and that they should just consent to it.
I think it's to say, I don't think much has changed. I think that it's still that non-verbal consent that I think we still get lost in. I mean, we as clinicians, sometimes if you say, is it all right to have your blood taken? They might not say anything, but they give you their arm or something like that, and you still have to check verbally. And I think in relationships, sometimes you might say yes to a certain sex act, and then it carries on, and people sometimes are unable to verbally say they don't want it to continue like that, but the person with them isn't reading that their body is frozen, or they're not kind of reacting in that way. They're lost in their own, what they're enjoying, and not really thinking about the other person. I think that's still happening. I don't think that that's changed much. And some of our work is talking about how the process of certain sex acts or certain things in relationships, and were you happy all the way through, or did you just kind of go with it because it was easier to do that than say something? And I think porn has got a lot to do with that still, and the porn that we see, and kind of obviously there's a movement towards more ethical porn. But I think our young people, how they access porn for the first time at 11 years old, and then that's what they found, especially as I think we are, as a country, the main consumers of porn as well. When you see all of these kind of stuff on social media, and then those sex acts like choking and things like that are seen as normal, and you are weird if you don't want that to happen. I think that feeds into whether people think they're actually consenting. Is it because of peer pressure rather than actually what they want?
And I know certainly the research into pornography is very much identifying that those themes of that's that misogyny culture, really, isn't it? It's that sort of dominance of women, like say, the choking, the male dominance, and I think that picks up potentially right at the start when you were saying, Marina, in terms of those kind of additional pressures on young people. I guess feeling like that's what they have to do. That is what sex is. That is what sexual acts are. And if they're comfortable with it or not, and that's been what they're being told is this is what you need to do. I guess even if they're not comfortable with it. No, thank you for that. And just to kind of pull us back to the safeguarding side of things. And obviously, like we say, you work within the health systems in Somerset Foundation Trust, and that being part of the multi-agency partnership arrangements as well. And I'm just thinking, particularly where we've got concerns around exploitation or abuse of children and young people. Have you got any good sort of examples of where SWISH have worked within that multi-agency safeguarding arena to protect your children and young people?
Yeah, I think, we're always working closely with the child exploitation team as well, their workers. We communicate well about their young people. So trying to work together to see a young person is something that we do quite often. There's a young person currently who we're desperately trying to. She has access SWISH, and she seems comfortable in SWISH and happy to come. It's her life is quite chaotic at the moment, so we're always trying to adapt and work with the other professional to get that young person access to contraception to at least address an unwanted pregnancy. But obviously there's lots of other issues going on. So it's really important to be working with other professionals that are working with that young person and know that young person really well.
Would you say you had generally good links with other agencies, like with the police, for example, if you got concerns, or do you think there are still some gaps there?
The days of Topaz, when we had meetings, seemed very beneficial, and that has stopped, but they still have the information portal that you can use. And we have the priorities meetings for West and East Somerset. So that's been something that we've just started to join.
We were obviously involved in JTI as well. That has, I think, like Marina said, we've always communicated well for, especially for children looked after in Somerset, but as well as with our colleagues, school nurses and other services that see young people. We've always kind of linked in for the sexual health bit of it. And with JTI last year, which was a year ago.
Sorry, Kerry, just to interrupt. So if anybody's not aware of what JTI is, it's the Joint Area Inspection that took place last year. It was on the theme of serious youth violence and exploitation, where there was an inspection of all of the partnership agencies on that theme. So sorry, Kerry, just jump in, just in case anybody wasn't aware of what that was.
So since that, I think that's given us more joint work with children looked after, with emergency department staff, with CAMS, forensic CAMS, education, police. So there's more work and development around, obviously, looking at serious youth violence, but then obviously looking at exploited children, and obviously sexual health feeds into that. So it's definitely improved in Somerset, I think. There's definitely improving and more communication within all of the services, obviously safeguarding included in that.
Putting on that, just to round us off, if you kind of had that magic wand around improvements, around changes in policy, in terms of change in practice, what would it be from your perspective as a sexual health clinic that you think would really sort of make a difference to safeguarding in a sexual health context? Is there anything you think, do you know what, if this came in or if this changed, this would really make the world a difference?
Not to have so many IT systems. It's very difficult because the information's very spread across different IT systems. But I mean, that's the nature of, I suppose, confidentiality, and people maybe wouldn't access our service or other services if they felt like everything was going to follow them throughout their journey in life even, and different things they access.
So I guess that sort of that greater joining up of information sharing and that closer working, like say IT systems are obviously these days quite often at the heart of that.
I agree with Marina about IT systems and just communication, really being able to more easily share and hold that person. Sometimes it feels like you checked one system and it says something, and then you check another one and it says something completely different, and then you might only have checked the first one, and then you have completely different understanding of that young person compared to something else, and then somebody else, you refer them to safeguarding, and who obviously checks all of them and gets a completely different picture to what you've got. I mean, that's why the beauty of obviously sharing information when we can, and being able to kind of all come together with the information that we've got. But sometimes it just seems like a long process when you've only got a short period of time with that person.
So I just want to highlight how amazing our young people are in Somerset. Whether they're coming in just to get their contraception and they're in that healthy, happy relationship, mum and dad are aware, everything's rosy, and they're really, really amazing young people. Even the ones that are really struggling at the moment or being exploited or have experienced sexual assault, they're just incredible young people. And I feel, we all feel in SWISH, I know we do, very privileged to be working with such amazing young people who have amazing skills. And, I think with a bit of nurture from society, other professionals and family, friends, actually, they're going to become really well-rounded young people. It's not all negative. I'm very proud of the young people that I see.
Guys, thank you so much for taking the time out today to come and talk to me about this, because I think it's really interesting. It's often an area that people aren't so much aware of. Hopefully I'm not talking out of turn here, but I think sometimes sexual health services can be seen as a bit of a sort of add-on in the background. But I think it's really important for people to understand that the really central role that you can play sometimes and the crucial role that you have in building that trust, that relationship with children and young people, providing them with that support and the really kind of important link that can make, not just in their relationships, but also, I guess, with other agencies, as we've talked about. So thank you for coming in. Really appreciate your time and great to hear from you. I'm just wondering if anybody wants to find out more about SWISH or your website or any resources, where's the best place for them to go?
www.swishservices.co.
Perfect. Lovely. Well, Kerry, Marina, Cassie, thank you so much again for your time. Really appreciate it. And take care of yourselves. Bye-bye.
Thank you. Bye.
Thank you.
As always, if you'd like to find out more details on the topics discussed in today's episode, please go to the SSCP website at somerset-safeguardingchildren.org.uk or by following any of the links in this episode's description. Now, if you enjoyed listening to the P-Pod, we would really appreciate it if you took that time to follow or subscribe to us on your chosen platform, or even better, leave us a review to let other people know about it, and make sure to let your colleagues know about this podcast and encourage them to join us here as well. It really does help to spread the word. Now, if you have any questions or comments arising from today's episode or would like to be involved in future episodes, we would love you to get in touch with us at thepod@somerset.gov.uk. Once again, I'd like to give a huge thank you to my guests today, Kerry, Marina and Cassie from SWISH. And as always, I would like to thank you for listening. My name is Steve Maccabee, and I'm the training manager for the Somerset Safeguarding Children Partnership. And I look forward to you joining us again next time at the P-Pod.
Let's work together to help keep children safe.